Are you struggling to memorize stroke information for your next nursing exam? Discover my straightforward method to mastering everything about strokes, including the causes, the signs and care, in just minutes. Let's crush the next nursing exam together.
Hi, nurse friends. I'm Shay, your fellow nurse with nearly 7 years experience, having the pleasure of working in several medical institutions across the country. We all know that nursing content can be quite complex and overwhelming. Let's change that. So whether you're preparing for your exams or wanting to just brighten your knowledge, you're in the right place. But before we get started, don't forget to grab your free digital lab cheat sheet. Use the link below. It will help provide a foundation to help you expand your nursing knowledge. So grab your pen and notepad and let's dive in. A stroke is also known as a cerebrovascular accident. It is essentially a blockage of blood flow to the brain, or the cerebral region. There are several different occurrences that can lead to an interruption in normal blood flow to the brain. These different occurrences help us identify the different types of stroke. There are 3 different types of stroke: hemorrhagic,
Thrombotic,
and embolic. Let's think of the cerebral arteries as a narrow highway that transport red blood cells that's carrying oxygen to the brain. If the highway is obstructed in any way, blood flow is disrupted and the oxygen is not delivered to the brain. Let's say we're traveling along the cerebral highway and a rumbling pipe ruptures. That pipe causes flooding and blocks the flow of red blood cells to the brain. Think hemorrhagic stroke. Remember, hemorrhagic stands for the rumbling rupture. A hemorrhagic stroke occurs when an artery or an aneurysm ruptures, and that rupture causes flooding of cells, obstructing the pathway of the cerebral arteries. Assume we are traveling along that same highway and we notice a buildup of trash along the route. The trash begins to pile up over time. Again, that trash buildup will disrupt the flow pathway of red cells traveling along the cerebral arteries to deliver oxygen. Think
thrombotic.
T for trash.
The trashy thrombotic. Thrombotic strokes
are the result of buildup that was previously formed within the cerebral arteries. Those clots or plaque in the cerebral artery that gradually build up over time will interfere with the normal blood flow that deliver oxygen to the brain. And lastly, sometimes vehicles travel from other areas in the body, carrying large amounts of cargo, traveling along the pathway and enter into the narrow passages of the cerebral arteries. And incidentally, that cargo is dropped along the way. That large cargo left behind in this narrow pathway hinders the flow of red blood cells, delivering oxygen to the brain. Remember, embolic vessels carry large cargo and can block the flow of blood to the brain. Embolic strokes occur due to embolus, such as a blood clot or fatty tissue that travels from another area of the body into the cerebral arteries, thus causing blockage and obstructing the flow of oxygen to the brain.
Embolic. Think E for embark. Fatty tissues or clots embark on a journey from other areas in the body, entering into the narrow passageways of the cerebral highway, causing an interruption of blood flow to the brain.
There are certainly signs and symptoms that us as nurses must identify when it comes to stroke. They're both subjective and objective. A tip for subjective: remember the subject is providing a viewpoint of their experiences, how they feel, what they see. Remember, subjective, hint, subject. So the patient may indicate that they feel weak, or that their vision is blurred, or that they feel dizzy. These are all subjective symptoms that the patient may be experiencing. Objective is verifiable. Tip for objective: remember, we objectively verify by assessing. The patient may experience aphasia, both expressive and receptive. Aphasia meaning the inability to express themselves or understand language. You may also see through your assessment that the patient may be experiencing some facial drooping. This is known as paralysis or hemiplegia, usually seen on one side, or hemiparesis, where the patient may feel weak on one side. The patient may also feel some neglect and unrecognized one side, left or right. Remember, strokes occur on either the right or left side of the brain. Each side of the brain is responsible for different functions that may or may not be affected if a stroke occurs. Depending on where the stroke took place, those areas are affected. The left side of the brain is responsible for language, mathematics, and analytical thinking, in comparison to the right side of the brain that controls visual and spatial awareness. So depending on where the stroke takes place, those areas can be affected.
Think B fast when identifying the signs of a stroke. B is for balance, E is for eyes, F is for face, A is for arms, S is for speech, and T is for time. Time is brain.
Time is brain when treating a stroke, which leads us into treatment. There are several different types of treatment when it comes to stroke, depending on the type of stroke. Remember, with the stroke, time is brain. Extensive periods of time lapse without adequate oxygen supply can cause cells to die. So no oxygen supply, it causes the cells to die. When treating a stroke, it depends on the type of stroke, but they all begin with imaging, a CT or MRI. The medications for treatment of a stroke also depend on the type of stroke. We have thrombolytics, which are administered within the first 4.5 hours from initial onset. Thrombolytics such as alteplase. We have anticoagulants such as Coumadin and enoxaparin, and antiplatelets, which are usually administered 24 to 48 hours after the onset of a stroke, such as aspirin. We also have antiepileptics such as Dilantin and Neurontin that are also used to treat strokes. And there you have it, friends. That was stroke. What was your favorite part? What are some things that will help you remember the topic of stroke? Remember to leave your questions and comments and share what topics we should dive into next. We'll see you next time, friends.